Hi, I'm Evan Minty. I'm one of the HCP BMI master's students, and I'm taking BMI 212 this quarter. I've partnered up with Albie Ling, who is a PhD student in the Shaw Lab, where I'm onboarded as an affiliate, and we were discussing doing a project in 212 on clinical pathway analysis through EMR data mining. So introduce us briefly already. I'm a practicing internist in Canada, just about finished the BMI master's program, and have done a little bit of work with the Shaw Lab previously. And Albie is developing a portfolio of ideas for her PhD thesis there. So clinical pathways can refer to a number of things. It can refer to treatment variations within a particular disease, so examining cases where best practice is not known and variation may present a natural experiment where you can discover it. You can examine cases where best practice is thought to be known and health system variation is actually undesired in those cases, so you can look to root that out. You can also take a more agnostic kind of 30,000 foot view and look at progression within diseases to greater degrees of severity or to other disease entities and try to predict that as patients develop diseases in the health system. So that presents a couple of potential research directions. One is examining pathways within a particular diagnostic topic, and one here that I think might be of interest to look at is thromboembolism. So that's a condition where blood clots typically form in the legs and then travel up to the lungs and can cause something called a pulmonary embolism. In some presentations or some variants of this disease, best practice is known, and we do think we know, for instance, how long in certain circumstances people should be on blood thinners. There's good guidelines in that respect. There's an emergent area of new therapeutics that could be looked at, but are generally well studied. There are other variants of this presentation where we really don't know what the best thing to do is. There's very small studies that are underpowered. So for instance, when a blood clot goes up that is very big but not big enough to cause shock, there's some question as to whether or not we should give clot dissolving drugs in those cases. We know it probably doesn't save any people's lives, but we wonder if it prevents longer term complications. And there's a whole area of devices that is entering this area of medicine where people are going into the legs and digging clots out, or trying to locally dissolve them, or stenting veins in some cases, inserting filters in other cases. And I would describe that as generally a rodeo, where I don't think people know quite what best practice is going to look like in a few years when this area does get eventually studied, but data mining might play a role in determining what people's outcomes are looking like. There's also a potential role for case finding in some of these cases where people go on to develop longer term complications and we don't actually necessarily diagnose it in time. And the second overall research area that we could look at is basically looking at the network topology of diseases within the EMR data set we have access to. And that would involve generating a large number of classifiers to find these cohorts, and then looking to see how patients flow between these different disease states and develop concurrent chronic diseases. This area of complex chronic disease is probably one that's understudied. These aren't populations that make their way into clinical trials, and so it's I would say kind of a bit of a greenfield area to look at some interesting trends. The data source that we're proposing to use is some Stanford Health System data that is provisioned through the Odyssey Common Data Model version 5 schema. So Odyssey is a network of collaborators that each kind of house their own data but have expressed it in a common schema so that analysis done at one site can be federated to the others to increase your cohort size. We wouldn't look at doing that within BMI 212, but it provides a interesting opportunity to extend the work afterwards to really increase the number of patients that are subject to the analysis. Thank you very much. I hope we're able to convince one or two people to join our team.